Good morning, everyone, and welcome to our first session of the day. On day two, we have an exciting lineup for today, and we're going to be kicking it off with a medical professional. Her name is Jennifer Marcusano. She lives in the Kansas City area, and Jennifer is not able to join us today, but she did do the honor of doing a recording for us. Jennifer is recently graduated from nursing school, and prior to that, she was an EMT specialist. So she has had a lot of activity in the medical arena as a medical professional, and is now working in the Kansas City area as a nurse in both a doctor's office and in a pediatric role at one of the hospitals. Jennifer is also a rare mom. She has two of her kiddos have a rare autoimmune disorder that they control through diet and also through infusions. So Jennifer has supplied us with a video to walk us through some of the advocating tips that's coming from a rare disease mom and as a medical professional. So I hope you enjoy her session, and we'll be back on after it's done to take any questions that you might have.
Hi, my name is Jennifer Marcusano, and I'm here to talk to you about advocating for yourself and your loved ones in the medical community. A little about me: I live in the Kansas City area, and I'm married to my high school sweetheart for 22 years. Together, we have 4 children who range in age from 21 to 11. And I'll get back to the kids in just a minute. Professionally, I'm a registered nurse. I work in a pediatric office, and I also just accepted a PRN position as a mom-baby nurse in a local hospital birthing center. I just graduated from nursing school in May of 2021, so I'm relatively new in that capacity. However, I'm not new to healthcare. In 2015, I went to EMT school and got my license so I could get some patient care experience. I worked for an ambulance service where we did inter-hospital transfers as well as ran 911 calls. And I also worked as a tech in the emergency department of a local hospital. I have worked as a secretary and admitting in emergency departments in the past as well. For the most of my time, though, I was a stay-at-home mom. After my oldest child was born, he was relatively healthy throughout his childhood. He didn't really catch colds. He didn't run fevers. He occasionally got strep, and he had 2 ear infections by the time he was 17. So maybe 7 or 8 cases of strep and 2 ear infections, but otherwise was healthy. When Josh was 27 months old, Zachary was born. At 3 months of age, Zach started having trouble. We were in Colorado, and he was having trouble breathing, and he just sounded terrible. You could hear him wheezing and just struggling to breathe. We ended up calling the pediatrician, and he called in some meds so that we could get him, keep him out of the hospital. And he was having to do breathing treatments and take steroids, even that little. His whole first year of his life was that way. A few days after his first birthday, Zach was hospitalized for the first time with RSV and pneumonia. He spent the better part of a week in the hospital getting deep suctioned and just trying to heal. 10 months later, he was hospitalized with RSV and pneumonia for a second time, and he spent another week in the hospital on oxygen and getting suctioned out. He was always sick until he was 11, mostly with respiratory issues and pneumonia. It got to the point that he would maybe only have one case of pneumonia a year, but it would take him out for 3 or 4 weeks. And he was still needing steroids and breathing treatments often, even when he didn't have pneumonia. The week after Zach turned 3, Sarah was born. At 3 months of age, she started having exactly the same issues as Zach, and at the same age. Besides the respiratory illnesses, she had many other health concerns over the years. Everything from mono at age 5 that caused her to run a fever of 104 for 6 weeks, to influenza B attacking her muscles and making it so she couldn't walk or even move her legs, to being treated for pneumonia for 4 weeks and still ending up septic, to going into respiratory distress while we were on vacation and having to be hospitalized out of town. Anna was born when Sarah was 4.5. When I was pregnant with Anna, I remember asking the immunologist what he thought the odds were that Anna would have the same issues as Zach and Sarah. He told me it wasn't very likely. He said, really, only one of your 4 children should have these immune issues. And so the odds that a third one out of 4 would have them are not likely at all. Well, 3 months into her life, we were dealing with the same respiratory issues as the other 2. Anna also had ear infections and had ear tubes placed at 9 months old. And even now, she continues to struggle with ear infections. She has been fighting one since June, this time, MRSA outbreaks, and broken bones that just don't heal. Even with the history of all of their issues, I could not get the pediatrician to listen to me. When Sarah got sick at the same age as Zach, and I tried to get her on medicine and take care of things, the pediatrician said, well, babies don't get asthma. Babies don't need breathing treatments. Babies don't need an inhaled steroid every day. And fortunately, I knew at that point, we immediately went to the immunologist and got her on meds so that when at 9 months old, she got RSV and pneumonia, she did not have to be hospitalized because she was already on the medications to help her lungs. And even with Anna, who was my third one that had these issues at the same age, the pediatrician still would not listen. It would not let me get treatment for her. Their stance would be, well, they need to be sick for 2 weeks before we'll treat them. And I would always say, have you seen what happens to them? You've seen them since birth. In 2 weeks without treatments, they'll be hospitalized. I never felt listened to. Anytime the kids would get sick, I would stress out over having to take them to the pediatrician's office because I knew they wouldn't listen to me. And the kids wouldn't get the treatment that they needed. My big goal with getting into healthcare is that I don't ever want anyone to feel like I have felt. I want everyone I treat to know that they are heard, even when their symptoms are outside of what may be considered normal or expected. I want to hear their theories on what's going on in their bodies. And I don't ever want them to hear, well, where did you get your medical degree? And yes, I did hear that from one provider. But we were fortunate. I had enough medical knowledge that I knew what the doctors were telling me wasn't okay. I wasn't afraid to stand up. And if I didn't get the answers I wanted, I wasn't afraid to look elsewhere. And we were fortunate that we found an awesome immunologist who listened well, treated the kids the way they needed to be treated, and he would even get them in for sick visits on the same day so that we could get them started on the meds they needed immediately. I might add, there is a good ending to this story. We got these 3 on immunoglobulin therapy, which has literally changed our lives. It got them off all antibiotics and steroids. It kept them out of the hospital. in the emergency rooms. And we got to actually go to the doctor for checkups rather than sick visits. Two years ago, our immunologist decided to try all the kids off their infusions and see how they would do. Zach has done amazing. He's 18. He started his freshman year of college in Southeast Ohio, where he was the starting goalkeeper and had the most saves in the entire conference. He is majoring in mathematics and got straight A's his first semester. He didn't even take any medications with him to school, not even an inhaler. Sarah has done pretty well off infusions as well. She has had maybe 4 or 5 colds or viruses over the last year, but she has not been too sick. She recently had a cough that hung on for a few weeks, and she needed breathing treatments and steroids and antibiotics for the first time in several years. But it did go away successfully, whereas in the past, it wouldn't go away. Sarah is now a sophomore in high school, and she has been involved in theater, show choir, and fine arts. Anna has been a mess with ongoing ear infections for more than 6 months that we have tried in multiple ways to treat with different antibiotics, different topical medications, treating it as if it's a fungal infection. We have seen the doctor half a dozen times. We have seen the ear, nose, and throat doctor 3 different times. And we're still fighting to get that cleared up. She's also had several throat infections, and she has constant MRSA outbreaks if she's not on antibiotics. She's been on an extremely strong antibiotic to keep the MRSA at bay. And last week, we added a second strong antibiotic to try and throw something different at the ear infection. Even with all of this, she plays competitive soccer and is a goalkeeper like her brother, though not currently with the broken foot that is not healing. She loves to draw and do digital animation, and she loves to spend time with friends. We are so thankful that we just got notification this week that the insurance company has improved her infusions again. We can't wait to get those started and get back to the level of health that she's had while on infusions in the past. Not everyone is as fortunate as we have been. According to the National Organization for Rare Disorders, the average time that it takes for a patient to be diagnosed with a rare disease is 7 to 8 years. I believe that a large part of cutting that timeline down includes teaching people how to advocate for themselves. Many people don't know that they are able to question what they are being told and advocate for themselves and loved ones. So this is what I'm here to tell you. You not only have the right to advocate for yourself, but you also have the responsibility to advocate for yourself. And I'm saying yourself, but I'm also including your children or your parents or loved ones or friends I think that when we talk about advocating, we think that that means standing up for ourselves. And absolutely, that's part of that. But more than that, in advocating for ourselves and loved ones, we have some responsibilities. We have the responsibility to share all information with those who are treating us. This can range from our previous medical history to family history, especially close family members, to medications, which includes supplements and even street drugs. The information that we need to share isn't always comfortable to talk about. And there can even be fear in bringing up things that may be embarrassing or illegal. But it is important that the providers have all of the information at hand to make the decisions about diagnoses and care for their patients. Be specific about why you made the appointment or why you are concerned. Also, make sure that you have medication lists, which include over-the-counter medications and supplements, complete with dosages. We have the responsibility to have our medical records at hand so the physicians treating us have the most current information. It's handy if we're within the same health system and they can just pull it up, but that is not always the case. So it's helpful to have your health information printed out so that you can hand it to the doctor before they see you. When possible, bring a friend or a loved one to your medical appointments. When a friend of mine was diagnosed with breast cancer 4 years ago, I went to every appointment with her. Oncology, breast surgeons, geneticists. Oftentimes, because the situation was so overwhelming to her, I was able to hear things that she missed. And it also allowed us to discuss everything in detail and compare notes and work on finding a solution in deciding who we wanted to see or who she thought would be the best person to perform her surgery and give her care. Have the provider write down the diagnoses and treatments. Oftentimes people get home and have forgotten what was said, and those medical terms are often long and uncommon words. So it's helpful to have that written down so you can look it up later. Don't be afraid to ask questions. I always appreciate it when the provider comes in and sits down. They go over everything, and before they ever stand up, they ask if we have questions. Not all will do that naturally, especially now with insurance companies dictating how much time the providers can spend with their patients. They get in a rush and they forget to ask. So don't be afraid to speak up and ask them to spend some extra time with you. Personally, I never mind waiting for a doctor who's running a few minutes behind because he spent some extra time with a patient. In order to accomplish the things that are mentioned, you need to spend some time preparing for your appointment. Gather any notes that you have from previous visits with providers, symptoms, including dates and what aggravated it, any treatments that have been tried in the past, how those treatments have worked or not worked. Make a list of any questions that you have prior to the visit. And be sure to keep something to take notes with at hand so that you can ask more as they come up. Also, don't be afraid to question things you are unsure of or uncomfortable with. You have the right to push against what you're being told if you don't agree. Don't be afraid to look for a new doctor if the one you're seeing is not answering your questions adequately or just not providing the care that you need. You can get a second opinion or even change providers. I always have a great deal of respect for a provider that says, this is a little out of my wheelhouse. I'd like you to go see so-and-so. They deal with this more often. The current doctor that I take my kids to, when we first went to see her, told me, my knowledge of immunology is that much. It's very little. You've been dealing with this their entire lives. So I'm going to defer to you. And so when I ask for a treatment that's a little unconventional, because we know that it's worked for my kids, she's happy to oblige. And that's what everybody should have. She also, in dealing with this ear infection with my daughter, said, I don't know what else to do. I'm going to send you somewhere else. And I always appreciate when they are willing to do that. If you're a parent, you have all of these same responsibilities when seeking care for your children. If you're a daughter or a son, you have the same responsibilities when seeking care for your parent. And if you're a friend or a caregiver, you have these same responsibilities when seeking care for them as well. My goal is to try to teach people how to advocate. I've been on both sides of this, both as a rare disease mom and as a healthcare provider. In my office that I work in, I'm always grateful for the parents who come in with a written list of questions or and know exactly what medications their children are taking, the dosages, any allergies to medications, and knows the medical history. I have 4 kids. 3 of them have significant health histories and issues. So I have their histories and dosages of medications in the notes on my phone so that I always have it at hand. This comes in handy when we have an unexpected trip to the doctor or to the hospital. Thank you for taking the time to listen to me today. This is something I feel very passionate about. If you have one takeaway from something I've said, it is to remember that you have both the right and the responsibility to advocate for yourself and your loved ones. If you have questions, please feel free to reach out to me. My email address is jennifer@marcusano.net. That is JENNIFER at M as in Mary, ARCHES as in Sam, AN as in Nancy, .net. Thank you.
So thank you, Jennifer, for sharing that with us. Thank you all for attending. The recording will be posted back into the event space shortly. And we hope that you enjoy the rest of the sessions today. And thank you for coming.